Hey, Dr. Frank here, another clinically relevant. This one's kind of cool because we're really looking at the effects or the differences between static needling, just sustained needle retention, compared to what we see a lot in the literature, which is essentially the pistoning effect. And this is the study itself. It's actually a good read. It came out just this year, but I'll break it down kind of based on their conclusions. So what was the study, right? So right off the bat, the study really looked at three different things. The first was pistoning, and they relate this back to Hong, which is an article many years ago looking at twitching as a main source of a treatment modality. They then, and essentially they did this for 2 minutes, without any type of needle retention, right? The second thing they did was they put the needle in and they moved it about 5 times in and out without coming out of the skin. If there was no twitch, they let it sit for an additional 1 minute, so 1 minute of needle retention. And they compared that to a sham component where it was using a spring-loaded device. No needle actually was inserted into the body. And the way they measured this, which was actually really kind of cool, when you looked at, the first thing they looked at was muscle tension, right? And the muscle tension really was measuring the frequency of vibrations with a myotonometer, all right? If I'm saying that correctly. The next thing was muscle stiffness, and they calculated this by tissue resistance to deformation, right? Pressure pain thresholds, which we normally use, and again, we look at that as an algometer, but they called it an algeciometer. They looked at handheld dynamometry for strength, or isometric strength. And then the two that I think are really cool, and it really shows the effects of dry needling, is laser Doppler. So they were looking at the real-time tissue perfusion, or the microcirculation that was going on. And then lastly, they were looking at power Doppler score. And the power Doppler doesn't measure speed of the blood flow. It essentially measures how much blood flow is present as a result of the dry needling. And they use a sonoscope to measure that piece of it. Now, the results of this, from the researchers' conclusions and clinical relevance of this whole process, is that the sustained outperformed the pistoning for managing of the myofascial neck pain, right? Increasing the pressure pain threshold, reducing both muscle guarding through muscle tension and muscle stiffness, improving tissue perfusion, which is a huge part of the effects of dry needling, as we know. And then lastly, had fewer adverse events, sort of a better safety profile and tolerability. Now, the researchers, they said, hypothesized that these superior outcomes of the sustained needling were likely due to a needle retention. Now, just simple sustained needle retention facilitates more consistent mechanical and neurological responses that they observed. So the idea that you have to get a twitch to have a clinical effect, according to this study, is not true. And based on the parameters and things that they actually looked at, I thought it was a pretty well done methodological study that showed you can do other things. So this is part 1 of this. In part 2, I'm going to talk about how our neurological approach really kind of emphasizes these effects and how being precise with your needling is probably more important than being overloading or aggressive.